stimulation be a modality therapy for a gut disorder such as irritable bowel syndrome. So we conducted systematic review and meta-analysis of the efficacy of RTMS for IBS. IBS or irritable bowel syndrome affect 1 in every 10 people worldwide. This accounts for 800 million people suffering for IBS. And the postulated mechanism of pathophysiology of IBS is a gut axis problem and brain axis problem. Therefore, we call it gut-brain axis dysregulation. This causes irritable bowel syndrome to be a multifactorial disease and have no definitive cure, and oftentimes pharmacotherapy often insufficient because this causes a global burden. Most of the pharmacology target the gut axis problem. They also target the brain axis problem, but often insufficient. Therefore, we need a better modality of therapy, especially in refractory IBS, which is 15% of all cases of IBS. Thus, why RTMS, transcranial magnetic stimulation, has been a neuromodulation since 2010 and is usually used as a brain axis modality therapy. So it helps with the top-down mechanism, thus reducing the symptoms of the IBS. But the big question is, there is a little consensus on whether transcranial magnetic stimulation is effective for IBS. Therefore, we conduct a systematic review of the efficacy of the transcranial magnetic stimulation for IBS patients. In our systematic review, we reviewed 98 articles, removed the duplicates, and found 4 articles which included in our inclusion criteria, which measure the outcome of the IBS patients, such as IBS severity, pain, anxiety, depression, and quality of life. We use a tool called Review Manager 5.4 and Cochrane ROB 2.0. The result of our review found a consistent positive findings of the efficacy of the RTMS for IBS patients, totaling 246 respondents. Furthermore, our meta-analysis showed the significant reduction in abdominal pain, significant reduction in anxiety symptoms, depression symptoms, also decreasement in the IBS severity score, and increasing in IBS quality of life, and also rectal pain threshold. The postulated mechanism based on our understanding is because dysregulated gut-brain axis is causing 4 problems, which is visceral hypersensitivity, psychological comorbid, dysregulated stress response, and altered gut motility, which RTMS target 2 specific area of the brain, which reduce the give the stimulation to thalamus, nucleus accumbens, very autoregrade, therefore increasing the endorphin and dopamine, and helps in reducing visceral hypersensitivity. And also target dorsolateral prefrontal cortex, which sends signal to limbic system, which increase the dopamine and serotonin, which will help with psychological comorbid such as anxiety and depression. It also sends signals to hypothalamus and brainstem, regulating the HPH axis and also reducing the sympathetic tone, increasing the parasympathetic tone. Therefore, it helps with regulation of the stress response and gut motility. This theory is in line with our findings, which our meta-analysis found the significant clinical outcome in all 4 studies. Therefore, this is the top-down mechanism of the RTMS. Therefore, in conclusion, we conclude that RTMS is a non-invasive, effective neuromodulation therapy, especially for refractory IBS. And RTMS is a potential adjuvant therapy for IBS targeting the gut-brain axis from top-down mechanism. Therefore, our further larger scale rigorous design RCT are warranted to establish and optimize the RTMS protocols for the LS. I want to give closing with pantun, bunga lili, bunga dandelion. Thank you very much for your attention.
Thank you, Doctor, for your presentation.
Pantun Dr. Bintang. Systematic review and meta-analysis on the effect of RTMS.
Yes.
What your aims to evaluate the efficacy of RTMS?
Yes.
TMS and RTMS different.
Yes, doctor.
Because RTMS repetitive.
Yes, doctor.
But cuman TMS.
Yes.
Artinya tidak sinkron dengan judul.
Yes, doctor. That's my mistake because I have not revised my abstract.
And then for the effect of transcranial magnetic stimulation for IBS. But your aim for improving pain symptoms and retardation in IBS, not IBS. Jadi di dalam ini judul itu IBS, tapi di sini justru hanya sebagian dari IBS. Jadi tidak ada kurang simpel. Ya, kesimpulannya.
Jadi pertama I'm using English Indonesia. Okay, jadi before in abstract I only look at the pain and rectal sensitivity, but in the next because I read their journal more, we found that it's not only improving the pain but also improving the IBS severity symptoms. But however, we did find one article that has positive effect on the rectal function. However, it is not significantly statistical because only in alkalinity at all. Therefore, I want to revise the abstract. Sorry, it's a mistake on my behalf.
Thank you very much.
Thank you.